Hey friends, it's Dr. David here from El Paso Manual Physical Therapy. I'm here with Kevin. Kevin's our student. He just started out 3 days ago. Today's Thursday. He started out on Monday. So he's getting indoctrinated to all this stuff. So he doesn't know what's coming right now. So we're live, so something crazy might happen. We're going to see about this. We're going to cover a C1, C2 manipulation. We'll work into that because I do want to just go through a mobilization real quick to be safe. That's kind of the way to check that you can do the manipulation. And this is the one that everybody freaks about. This is the one that if you have any patients that have been to a chiropractor, they're worried about this technique. So let me just start off by saying that if you have that patient that comes in and tells you that they hate chiropractic or they had a bad experience with chiropractic or they're afraid of it, maybe they never had it, they just seen people get manipulated or adjusted in their neck and they don't want it, this is a technique you want to avoid with them. Don't do it. So and honestly, I don't build it up to anybody, any patients coming in. I don't tell them all this stuff that I'm telling you. I don't mention it to them. All I say is hey, I think you have a joint that's stuck up there. I can free it up. There's a technique that I like to do if you're okay. It's just going to put some stretch on your neck and you should be fine. It should feel better afterwards. The only thing I'll tell them is let me know if it hurts and I'll stop and I'll back off. So I'll do a little mobilization leading up into it and then we'll get into the manipulation and I'll check with them. I don't sneak up on them either. I'm not just going to be like, all right, on 3, 1, wah. That's not cool. Patients don't like that. So real quick, the telltale signs of somebody having some sort of vertebral artery problem, because that's the big concern here, is a headache, of course, neck pain, but they'll have other comorbidities like hypertension. They're usually in poor health in general, diabetic, obese, hypertension, all those cardiovascular situations. So if I get a client that's coming in like that and they're talking about neck pain, I am not doing any manipulations in their neck. I just avoid it. I'll mobilize and I'm careful. It's typically our younger people that do really well, are healthy, fit. Look at this guy, he's got some muscle on here, he works out every day. They're gonna do pretty well with manipulations. But even then, you need to be cautious and careful because you can have anomalies. So you always want to check first that they're gonna be okay to tolerate it and that they're not gonna stiffen up, because with this technique, it puts you in a position that you just feel like, oh, that's uncomfortable for a moment, and then you just have to go just an eensy bit further to get the manipulation in, and they have to be able to relax during that extra bit of motion you're going to put them through. So if they're not relaxing through it, you got to abort. You have to ditch the technique or just mobilize or do something different. So let's get into it. First off, you have to lock out the cervical spine, everything below C1, C2. So I'm going to go over to the right here. We're going to side bend all the way, and I'm cradling here the occiput, holding with along the jawline over the zygomatic arches, and maintaining some side bend right here. I'm going to rotate contralaterally. So just relax our Kevin as best you can. See how he was tensing up unknowingly, and then he relaxed. Real slowly, I'm going to move him over, and what I'm looking for here is any wincing, signs of discomfort, and I'm talking to the patient usually. I don't have a camera running on us normally. And I'm looking to see if he gets to end range. Now normal is about 45 or more, so that actually looks pretty good. He doesn't look like he wants to cry. He looks pretty darn good, so we're okay. It doesn't seem to be like there's a C1, C2 restriction there. Now let's go the other way. And normally I'd be like this, but I'm gonna block the screen, so I'm just gonna give you guys some space, so just know that my mechanics aren't the best right here. I'm going to go over to the other side now. And he's actually pretty good, so we don't need to do a manipulation on him as far as treatment. But I'm going to go through the technique real quick, and just so that you know, and if you find somebody, we'll pretend that Kevin's got a restriction here. What we would find is you have to check both sides to get a comparison, and right about here, people are typically wincing, they're making a scrunchy face, they're saying ow, they're starting to tighten up, and I'm feeling resistance. I won't feel like I can go much further. If you're gonna mobilize from there, all you would do is maintain that side bending and then just wiggle it. And see how I'm wiggling my body? That's what you wanna do, because in order to maintain the side bending, you have to kind of not move your hands, you have to move your body more so. And if you don't want to manipulate because you're not comfortable, you can totally just hang out in a mobilization, and sometimes you have to kind of come off of it for a second because it's kind of a big twist for their neck, and then come back into it, and what you usually find is that they can go a bit further. But let's say that the mobilization just isn't cutting it, you're not getting what you want, then what you would do, you okay if I adjust here or manipulate? Sorry, we're not adjusting, I'm not a chiropractor. We're manipulating, it's completely different. No sarcasm. So we get to the end range there, and see my hands, I didn't feel like I had enough motion to get over, like I ran out of room in my arms to move, so I have to readjust my hands a bit. And I just kind of like to bounce at the end just to feel the end field, and also get the patient comfortable to the position here. And then once I'm at the end, I just start loading up the tissue, and then just go into it just a bit like that. Now, Kevin's mobile, so I'm not going to force it. There's no need to force it. Why? It's already moving good. So if you find that somebody's decently mobile, don't push it. You'll be all right. You don't need to do that technique. There's likely something else that's restricted, or some soft tissue restriction if the person still has a neck problem, or pain in the area, or some dysfunction, some sort of a limitation. So there's your manual therapy Thursday, C1, C2, mobilization, manipulation. Have a great day, guys. Bye-bye.